Hello everyone, welcome to my channel Dr.shil's Physio Victory. Today I will discuss about some previous year questions of CUET PG. This is the part 2. If you haven't seen part 1 yet, please go and check in the watch list. Let's start. Today's first question is: the patient is lying prone. The examiner squeezes the calf muscles. The absence of plantar reflex on squeezing calf muscle indicates option 1, ruptured Achilles tendon, option 2, lateral tibial torsion, option 3, peroneal tendon dislocation, option 4, anterior talofibular ligament strain. Here the clear answer is option 1, rupture of Achilles tendon. This is called Thompson Test. Or Simon Test. Lateral tibial torsion, a bony alignment issue. This is a bony alignment issue. Peroneal tendon dislocation causes lateral ankle stability. In lateral ankle instability, not a plantar flexion loss, and ATFL ligament affects ankle stability. Plantar flexion remains intact. Next, come to question number 27. A patient complains of lightheadedness, nausea, and spinning vertigo while lying in bed, turning in bed and bending over to pick objects from floor. He also feels off balance while walking. He is most likely to have option 1, benign paroxysmal positional vertigo, option 2, migraine, option 3, Meniere's disease, option 4, vestibular neuritis. Here the correct answer is option 1, benign paroxysmal positional vertigo, or BPPV. Basically BPPV triggered by turning in bed and bending forward due to otoliths in semicircular canals. Migraine is headache dominated. Meniere's disease is vertigo plus hearing loss plus tinnitus. Vestibular neuritis is a acute severe vertigo without positional trigger. Next, come to question number 28. Cognition is assessed by testing the following. Option A, fund of knowledge. Option B, agnosia. Uh, these are not the options. These are parts. Option A is funding of knowledge. B is agnosia. C is proverb interpretation. D is 2-point discrimination. Choose the correct answer from the option given. Here, the correct answer is option 3. Basically, A, B, and C is correct. D is 2-point discrimination is basically a sorry. D is basically a sensory cortical test, not a cognition. Fund of knowledge is general awareness. Fund of knowledge is basically general awareness, which includes in cognition. Agnosia is uh, agnosia is a failure to recognize the object. Failure to objects. And proverb interpretation is abstract thinking, which involves frontal lobe. Proverb thinking is abstract. Proverb interpretation is abstract thinking. It's also included in cognition. Next, come to question number 29. Obligatory flexor synergy component observed in upper limb following stroke are option 1, scapular protraction, shoulder adduction, internal rotation, elbow extension, forearm pronation, wrist and finger flexion. Actually, next is option 2 is scapular retraction, shoulder abduction, external rotation, elbow flexion, forearm supination, wrist and finger flexion. Scapular, option 3 is scapular protraction, shoulder adduction, internal rotation, elbow extension, forearm supination, wrist and finger flexion. So the correct answer is option 2, scapular retraction, shoulder abduction, external rotation, elbow flexion, forearm supination, wrist and finger flexion. Next, come to question number 30. The term tic douloureux is used to indicate the sharp shooting pain on the face is a result of affecting of the following nerve. Option A, facial nerve. Option 1, facial nerve. Option 2, trigeminal nerve. Option 3, trochlear nerve. And option 4, glossopharyngeal nerve. Here, the correct answer is option 2, trigeminal nerve. This is also called trigeminal neuralgia. Tic douloureux is also called the Trigeminal neuralgia. It's a sudden electrical shock like facial pain, basically, which affects trigeminal nerve or cranial nerve 5. Facial nerve involves motor, facial expression, trochlear nerve is basically cranial nerve 4, which helps in eye movement. Glossopharyngeal nerve is cranial nerve 9, which helps in the throat, leads to throat and tongue pain. Next, come to question number 31. Dash consists of repeated cycles of 3 ventilatory phases: breathing control, next thoracic expansion exercise, and the last forced expiratory technique. Option 1, functional breathing technique. Option 2, passive cycle of breathing technique. Option 3, active cycle of breathing technique. And option 4, manual hyperinflation followed by secretion clearance. Here the correct answer is active cycle of breathing technique. Active cycle of breathing technique has 3 phases. First phase is breathing control phase. Second phase is thoracic expansion phase. And third phase is forced expiratory technique or huffing. This is used to clear airways in COPD, bronchiectasis or postoperative patients. Functional breathing technique is used for relaxation. Passive cycle is therapist assisted. And manual hyperinflation generally used in ICU. Next, come to question number 32. Which of the following intervention facilitates the removal of airway secretion collected centrally? Option 1, incentric spirometry. Option 2, pursed lip breathing. Option 3, suctioning. Option 4, manual percussion. Here the correct answer is option 3, suctioning. Central secretions equals to basically trachea or main bronchi. Suctioning directly remove secretion from large airways. Incentive spirometry using lung expansion, for sleep breathing improve, ventilation, and manual percussion mobilizes peripheral secretions. Next, come to question number 33. The age-related decline in the VO2 max can be offset by option 1, aerobic training, option 2, meditation, option 3, relaxation technique, option 4, periodic assessment of respiratory functions. Here, the clear answer is aerobic training. Option 1 is the correct answer. VO2 max decline with age due to reduced cardiac output and reduce muscle mass. Regular aerobic training basically improve oxygen utilization, increase stroke volume, and slow age-related decline. Meditation is used for mental benefits. Relaxation is to reduce stress. Periodic assessment, not basically physiological improvement. Next, come to question number 34. All these are absolute contraindications to exercise training except option 1 unstable angina, option 2 pulmonary edema, option 3 uncontrolled hypertension, option 4 resting tachycardia. Here the correct answer is option 4 resting tachycardia. Resting tachycardia में एक्सरसाइज बेसिकली किया जा सकता है. बाकी इन तीन ऑप्शन में, इन तीन केसेस में एक्सरसाइज इज contraindicated, absolute contraindicated. Next, come to question number 35. The dash in plyometric training should be kept as brief as possible for maximum effect. Option 1 concentric phase, option 2 eccentric phase, option 3 counter movement phase, option 4 amortization phase. Here the correct answer is option 4 amortization phase. Amortization phase is basically always try to keep reduce plyometric exercises has basically three phases. One is first is eccentric phase, second is amortization phase, third is concentric phase. Basically, shorter amortization phase leads to better stretch shortening cycle, leads to greater power output. Next, come to question number 36. The following training feature after ACL reconstruction should be avoided. Option 1 close kinetic chain close chain strengthening of quadriceps between 60° to 90° of knee flexion. Option 2 open chain training of quadriceps between 90° of flexion to 60° of flexion. Option 3 isometric quadriceps exercises. Option 4 exercises on continuous passive motion unit. Here the correct answer is open chain training of quadriceps between 90 to 60° of knee flexion. This should be avoided. Open chain knee extension between 90 to 60 basically causes excessive anterior tibial translation. First point is excessive anterior tibial translation, and it also increase strain on ACL graft. Closed kinetic chain is basically safe. Next, come to question number 37. Which of the following technique involves voluntary muscle contractions by the patient in a precisely controlled direction, and intensity against a counter force applied by the practitioner? Option 1, rhythmic initiation. Option 2, muscle energy technique. Option 3, neuromuscular stimulation. Option 4, active stretching technique. Here the correct answer is muscle energy technique. Option 2 is the correct answer. Muscle energy technique uses patient's voluntary contraction against therapist controlled resistance, used basically to improve joint mobility, reducing muscle tightness, and correcting biomechanical dysfunction. Rhythmic initiation is used for motor learning, uh, neuromuscular stimulation is the electrical stimulation, and active stretching is no counter force. There is no counter force. Next, come to question number 38. Affective uh, psychotic disorders include which one of the following? Option 1, delusional disorder. Option 2, bipolar disorders. Option 3, schizophrenia, and option 4, mental retardation. Here the correct answer is option 2, bipolar disorder. Bipolar disorder affects, basically it's a mood disorder with psychotic feature. It includes mania and depression. It includes basically mania, depression, and psychotic symptoms are basically delusions and hallucination. Delusion disorder is non-affective. Schizophrenia is a primary psychotic, and mental retardation is developmental disorder. Next, come to question number 39. Which of the following is a non-modifiable risk factor for development of COPD? Option 1, increasing age. Option 2, tobacco smoking. Option 3, exposure to noxious fumes at occupational setting. Option 4, increased use of biomass fuel. Here the correct answer is increasing age. because you cannot modify age. Age basically causes reduced lung elasticity and reduced alveolar surface area. Next, come to question number 40. Leprosy was detected by option 1 Hansen, option 2 Rose, option 3 Robert Koch, and option 4 Reed. Here the correct answer is Hansen. Rose basically discovered malaria. Robert Koch discovered tuberculosis, and Reed discovered yellow fever. Next, come to question number 41. In the context of outcome measure, dash is the degree to which an outcome is measuring what it purpose to measure. Option 1 reliability, option 2 validity, option 3 internal consistency, and option 4 responsiveness. Here the correct answer is very easy. I have already discussed in my previous video, that is validity. Reliability refers to the consistency or uh, repeatability of an instrument, not necessarily its accuracy. And internal consistency refers to the degree to which different items on a test measure to same construct. And responsiveness indicates how well an outcome measure detects change over time. Next, come to question number 42. A therapist recognizes the patient's visiting his clinic according to their blood group A, B, AB, and O. This is an example of option 1 ordinal level measurement, option 2 nominal level measurement, option 3 rational level measurement, and option 4 interval level measurement. Here the correct answer is nominal level measurement. In nominal level there is categorization only. There is no order or no ranking. Blood groups are names and level only. In ordinal level there should be a ranking 1, 2, 3, 4 like this. Interval measurement equals equal intervals. There is no true zero, and rational level is there is true zero exist. Next, come to question number 43. Evidence-based medicine involves option 1 integration of best research evidence with clinical expertise and patients' unique values and circumstances. Option 2 integration of expert opinion with clinical expertise. Option 3 treatment based on research evidence and clinical expertise without any regard for patients' values. Option 4 treatment based on case control studies. Here the correct answer is integration of best research evidence with clinical expertise and patient values. Option 1 is the correct answer. Next, come to question number 44. Equal distribution of all members of a group comes under the following moral principle. Option 1, beneficiary. Option 2, autonomy. Option 3, justice. Option 4, non-malfeasance. Next, the correct answer is option 3, justice. Next, come to question number 45. Progression notes for a patient are written in SOAP. SOAP means subjective objective assessment plan. Anticipated goals and expected outcomes are included in option 1, subjective. Option 2, objective findings. Option 3, assessment. And option 4, planning. Here the correct answer is very easy, that is planning. Subjective is basically describes the patient's perspective and experience. Objective findings basically includes measurable findings from the examination. Assessment, the healthcare providers analysis and diagnosis. Next, come to question number 46. The correct sequence at the postsynaptic membrane during neuromuscular transmission at neuromuscular junction is, ये सब सीक्वेंस में सजाना होगा. ऑप्शन ए, opening of ligand gated sodium channel. B is binding of acetylcholine with receptor and formation of acetylcholine receptor complex. C is entry of sodium ion into the ECF, and D is development of end-plate potential. Choose the correct answer from the options given below. तो इस क्वेश्चन को हम लोग इमेज से समझेंगे. दिस इज द इमेज. न्यूरॉन है जो कि मसल्स में आके मिल रहा है. इस एरिया को अगर हम कलर चेंज कर लेता हूँ, इस एरिया को अगर मैं जूम करता हूँ तो वो ऐसे दिखेगा. तो सबसे पहले इसमें क्या होगा, सबसे पहले एसिटाइलकोलिन बाइंड्स टू निकोटिनिक रिसेप्टर्स. यहाँ पे ये जो लाल डॉट्स दिख रहा है ये सब एसिटाइलकोलिन है. ये आके यहाँ पे बाइंड होता है. उसके बाद क्या होता है, दिस कॉजेज ओपनिंग ऑफ लिगेंड गेटेड सोडियम चैनल. तो उसके बाद इस जगह को मैं अगर जूम करूं तो देखो यहाँ पे आके एसिटाइलकोलिन जब लगता है उसके बाद ये सोडियम चैनल ओपन हो जाता है. यहाँ से सोडियम बाहर निकलता है. ठीक है. उसके बाद क्या होता है, एंड प्लेट पोटेंशियल डेवलप होता है. एंड आफ्टर दैट, तो सबसे पहले जो होता है वो है आपका बाइंडिंग ऑफ एसिटाइलकोलिन विथ रिसेप्टर and formation of acetylcholine receptor complex. So B is the first. So B यहाँ पे भी है, B यहाँ पे भी है. उसके बाद क्या होता है, उसके बाद होता है ओपनिंग ऑफ लिगेंड गेटेड सोडियम चैनल जो कि A है. A भी यहाँ पे है, यहाँ पे है. उसके बाद क्या होता है, जब सोडियम चैनल खुल जाता है, सोडियम बाहर निकलने लगता है तब होता है एनप्लेड पोटेंशियल डेवलप होता है। सो डेवलपमेंट ऑफ एनप्लेड पोटेंशियल डी। सो और करेक्ट आंसर इज BADC, option 4. Next, come to question number 47. In the dorsum of hand, the correct arrangement of tendon from lateral to medial. A is extensor carpi radialis longus and brevis. B is extensor digitorum. C is extensor pollicis longus, and D is extensor digiti minimi. So, मीडियल टू लैटरल सबसे पहले हम लोग एनाटॉमिकल पोजीशन में सोचेंगे। थंब के साइड में जो होगा वो लैटरल होगा एंड लिटिल फिंगर के साइड में जो होगा वो मीडियल होगा। ठीक है, तो इसमें क्या होगा, इसमें सबसे मीडियल जो रहेगा वो लास्ट में आएगा, क्योंकि यहाँ पे बोला है फ्रॉम लैटरल टू मीडियल, तो लास्ट में जो आएगा वो होगा डिजिटी मिनिमी, जो कि ऑप्शन डी है। अभी ऑप्शन डी इसमें भी है, इसमें भी है और इसमें भी है। ठीक है, so with this image we'll understand this is basically medial side, this is lateral side, because this is in pronation phase. This is extensor pollicis longus, this is extensor pollicis brevis, this is extensor carpi radialis longus tendon, and this is extensor carpi radialis brevis. This is extensor digitorum. So सबसे पहले कौन रहेगा, सबसे पहले रहेगा आपका एक्सटेंसर कार्पी रेडियलिस लॉन्गस एंड ब्रेविस, ये दोनों क्योंकि ये यहाँ से आ रहा है, उसके बाद ये आ रहा है। एक इसमें है, ऑप्शन 1 इज द करेक्ट आंसर। सबसे पहले आएगा एक्सटेंसर कार्पी रेडियलिस लॉन्गस एंड ब्रेविस, उसके बाद आएगा एक्सटेंसर पॉलिसिस, ये जो एक्सटेंसर पॉलिसिस लॉन्गस है ये उसके बाद आएगा, ये 1, ये 2, ये 3 और ये 4 होगा। Next come to question number 48. If a suitable liquid medium is inoculated with bacterium and incubated, the growth of bacterium follows a definitive course. The sequence of phases of bacterial growth कर्व इज ए में है रेट ऑफ डेथ exceeds rate of reproduction and the bacterial population decreases due to the cell death. So this is basically death phase बोला जाता है. डेथ फेज जो सबसे लास्ट में आता है. तो हम लोग देखेंगे ये सबसे लास्ट में किस किस में, ये तीनों में है, तो ये रूल्ड आउट हो गया. उसके बाद ऑप्शन बी, इन लैग फेज देयर इज एन इंक्रीज इन cell size and no increase in cell number. Necessary enzymes and metabolic intermediates are built up for multiplication to proceed. So ये जो लैग फेज होता है ये सबसे पहले आता है. तो बी किस में पहले है, इसमें भी पहले है और इसमें भी पहले है, तो ये भी रूल्ड आउट हो गया. ठीक है. उसके बाद सी ऑप्शन देखेंगे. सी क्या बोल रहा है, सेल डिवीजन स्लो डाउन एंड स्टॉप्स ड्यू टू depletion of nutrients and accumulation of toxic production. There is an equilibrium between dying cells and the newly formed cell. ये ना, ये बेसिकली प्लेटू फेज होता है जो कि मिड फेज में आता है. ठीक है. सो ये थर्ड फेज होगा. सी वुड बी द थर्ड. सी थर्ड इसमें है. सो और करेक्ट आंसर इज ऑप्शन 1. अभी हम इमेज से ये समझेंगे. सबसे पहले होता है लैग फेज, उसके बाद आता है एक्सपोनेंशियल फेज जो कि यहाँ पे एकदम लास्ट में बोला गया है डी में. इन लॉग फेज सेल नंबर्स इंक्रीजेस एक्सपोनेंशियली और बाय जियोमेट्रिकल प्रोग्रेशन विथ टाइम. ठीक है. जो कि ये है, इसे बोला जाता है लॉग फेज. दिस इज स्टेशनरी फेज और प्लेटू फेज एंड दिस इज द डाइंग फेज जो कि यहाँ पे पहले दिया गया है. So, this is A, this is D, this is C and this is B. B, D, C, A are correct answer. Next, come to question number 49. The correct sequence of Ujjayi Pranayam is A. सबसे पहले close eyes and exhale completely. उसके बाद बी में बोला जा रहा है hold the breath for a second or two, then exhale slowly and deeply to empty the lung. Option C, sit in the Padmasana with arms outstretched and back of wrists resting on the knees. So C सबसे पहले होता है. So C सबसे पहले इसमें ही है, तो और कुछ पढ़ने का जरूरत ही नहीं है. C is the correct answer. Option 3 is the correct answer. Next, come to this is basically the Ujjayi Pranayam phase. It is also called ocean breathing. Next, come to question number 50. The sequence of vascular events that takes place during an acute inflammatory response. Acute inflammatory response में क्या क्या sequence, acute inflammatory response में क्या क्या events होता है. Persistent progressive vasodilation involving mainly the arterioles. B में बोला जा रहा है elevated local hydrostatic pressure causing transduction of fluid into the extracellular space. C बोला जा रहा है slowing of microcirculation causing increased red cell concentration followed by peripheral orientation of leukocytes along the vascular endothelium. लास्ट बोला डी में बोला जा रहा है ट्रांजिएंट vasoconstriction of arteriole is the last. Choose the correct answer from the options given. सबसे पहले जो होता है वो होता है सबसे पहले होता है transient vasoconstriction of arterioles. Transient vasoconstriction of the arterioles. This is the initial and brief response. Basically, it lasts for कुछ ही सेकेंड्स के लिए या मिनट्स के लिए रहता है. ये इमीडिएटली आफ्टर इंजरी होता है. ठीक है. सो डी सबसे पहले होगा और यहाँ पे डी सबसे पहले है. सो ऑप्शन 4 is the correct answer. Thank you everyone for watching this video. Please do like and subscribe to my channel and comment in the comment box if what topic you want to learn in the next video.